So thank you to Javier and Jen who are joining us today to share their project that they've been working on supporting a diverse AHP workforce, scoping career and clinical education opportunities and experiences. So I'll hand over to you guys. Thank you very much.
Thank you, Rachel. Thank you for inviting us today and giving us a chance to share this project that we've done. So we were asked by sort of the Integrated Care System and Health Education England to do a project looking at diversity, and this is what we've done. So the main aims of the project were to understand if students are considering a career in allied health professions within the Nottingham ICS. So it's the first time this type of project's been done within our ICS as well. And when we did our research, the first time this has been done, maybe, a bit further out as well, sort of nationally too. It was to understand the ethnic diversity of the AHP student population. So who's actually coming to these professions and who's coming to learn these professions, and to gain an understanding of the experience of BME AHP students at university non-placement within the ICS. And I think this is so important to find out how students are actually getting on, what their views are, and how we can improve that.
So we went about this study in quite a few different ways, really. So it was a mixed methodology we used. We sent out freedom of information requests to a lot of the local universities and slightly further afield as well, the universities that cover all the AHP courses and send students on placement into the integrated care system. And we asked them for details such as the number of applications they're getting from BAME students as well as white students, the number of interviews they offer these students, and then also the number of offers that they make at the end of it to these students. And from that, we could look at what percentage of students get made offers from university, depending on whether they're BAME or whether they're from a white background. We did one-to-one interviews with BAME AHP students, and this was part of learning about their experience on placement with the integrated care system and also about their experience of being at university as well. We also held discussions with university EDI leads and admissions tutors to understand what universities are doing to help improve EDI. We sent surveys to college students and careers advisors. And the aim of this was to understand what A-levels the students were taking and whether they're the right A-levels to be able to access AHP courses. Also to understand whether they're considering a career as an allied health professional. And also from a careers advisor's point of view to understand what they're doing to support their BAME students in accessing these courses and to understand if they have the right resources to be able to direct students to. We also gained a lot of data on work experience opportunities, looking at which allied health professions are offering work experience across the ICS and also how many work experience placements are being offered. And we looked at this the year before COVID because obviously work experience stopped during COVID. So we went back to 2019 to look at this data.
So the key results from some of those methodologies was we found that physiotherapy and paramedics was the most popular profession, and people kind of were aware of these professions. However, they had the lowest number of BAME students on these particular courses, which was surprising. And then also some of the courses, some AHP courses are quite diverse. However, we were finding that within our ICS, that diversity doesn't represent from university to our sort of workforce. And then there were some professions like orthotists and podiatrists and osteopaths that students weren't very aware of. So there's obviously some work that needs to be done around this to increase that awareness and understanding of all these different professions that are available to everybody.
So there's quite a few contributing factors that play into this, really. The first one is inclusivity and racism, and that came up a lot in our one-to-one interviews that we did with AHP students. Quite a lot of students experienced a lack of inclusivity on some placements. Some people reported really good placements, which was very good. And a lot of people said that they found the placement, they learned a lot, but actually it was that feeling of inclusivity that they lacked at times. Some students experienced racist abuse from patients, which was really sad, and they found very little support from their educator as well when that happened. And that's makes it even worse for students, I feel, not only that they experience racist abuse on placement, but then also if the clinical educator at times didn't even ask if they were okay afterwards. And for a student, that's awful. That's not a very nice situation to be in at all. And students feared speaking up about racism on placement. They, one, didn't know who to report it to, and also they feared that it would impact on their marks, or just worried in some way that it would reflect negatively on them. Family and culture was another contributing factor. We found from our student and sixth form surveys that BAME students are more likely to consult their family for careers advice, whereas students from a white background were more likely to access careers advice from the internet. So students found that at times some families were against AHP careers, and that was more due to the lack of knowledge around the role than anything else. So students are being directed more, well, maybe consider medicine, consider nursing, consider the more well-known professions as opposed to the allied health professions, just sometimes because families weren't aware of the roles. And then training as well was another contributing factor. So opportunities for work experience. We found that some allied health professions through the ICS do not offer any work experience at all, or do not advertise work experience. So some opportunities are only for people if you knew someone in that profession, you could get work experience, and that was quite a barrier for people. Also, the routes into the professions at times were another barrier. And I know as an ICS, that's something that we're working on, looking at apprenticeships, which I feel will be really positive. But sometimes just the university route isn't right for everybody. And some students reported that from a financial point of view, going to university was just not an option for them. Poor placement experience again, and sorry, my light's gone off in the background, hasn't it? It's gone dark. Sorry, they're gonna have to edit it out.
Edit that out.
There we go. Right, sorry, they're gonna have to do some editing. Poor placement experience was another problem, and that has been linked to higher attrition rates. So students are more likely to drop out of their university course if they have poor placement experience, and that can have a huge impact on someone, particularly if you're assigned to one area for the whole of your training. If you're not getting on in that area, or if you're having a poor placement experience there, that's very difficult then. Whereas other professions such as physiotherapy, you work in several different areas and have several different educators during your career. And what we found from the Freedom of Information request that we sent to universities, that at some universities, BAME students are up to 20% less likely to be offered a university place. And that does vary a little bit on profession, but that is a trend that we can see overall. And that is something that obviously we're taking back to the universities to discuss with them, and to say, kind of try to understand why this is happening. Sometimes for some professions, we can see that it's not at the application stage. It's not at the interview stage, it's at the application stage. So you're less likely to be offered an interview. Whereas when it gets to the interview stage, it's very similar, whether you're likely to be offered a place or not. But it looks like on some professions that for whatever reason, some students are not progressing past the application point of the process.
We've brought all our findings together into a report, and we have made various recommendations to the ICS, the higher education institutes, schools and colleges, people that are responsible for sort of careers advice and work experience. So we have various recommendations that we have made to help improve the experience of BME students, and also what to do to go forward as well, to sort of work on the work that we've done within this project. So the main sort of recommendations that we highlighted for the ICS were to identify the barriers for clinical educators not challenging racism. So actually providing training and actually just working out what the reasons are that people find it difficult to challenge this, and making sure that the support for students is there. To understand the experience for the BAME AHP workforce regarding inclusivity, career development and promotion opportunities. And the reason for this as well is, if it's fine, we are encouraging people to come into this profession and we are trying to ensure that their placement is a good experience, but if their experience within the workforce isn't good, then they're not going to stay within our ICS. So it's making sure their experience throughout is a good one. And to raise awareness of the small but vital allied health profession roles to the wider community. And I think what we were finding is, with the one-to-one interviews and just scoping in general, that actually a lot of these AHP professions are maybe not fully understood sometimes, and it's creating that awareness and promoting them within all communities. So I think, Jen, you could probably agree that we've learned so much from this project. And I think for me as well, it's really opened my eyes to the barriers that some people are facing, and some of that racism that people are still facing, and the importance of sort of working from this to improve the student experience across the board, in terms of awareness of this for across the student population, but also within the BME community too.
And it's really made me think as well, as a clinical educator myself, how would I respond in that situation? How would I support my student if they were to experience racism, and how I go forwards with that, and with the support we give students, because any student that I bring out on placement into my team, I want them to have a really good experience. So it's really made me think about how I can offer the best clinical placement to our BAME students.
And I guess, sorry, one last point as well is, why are we doing this? What's the point of this project? And we know that our workforce within the Nottingham ICS is not representative of our population. And that is so important, to be able to meet the needs of our patients. And if we haven't got that diversity within our workforce, then we aren't meeting those needs. So it's really important that we encourage diversity within our workforce, and therefore meet the needs of our patients.
Thank you so much. I think, yeah, it's just so important, like you said, that our workforce does represent the populations we work with, and we have a long way to go still, but it's projects like this that are kind of helping us work towards that. And I guess for our educators in the trust, I think having just those moments to reflect and think, how would I deal with this situation, or how can I prevent these situations, I think is really, really important. But yeah, thank you so much for that. That's really, really useful.
Mm-hmm.